So this is going to be part 1 of our acute thorax series. Before we go into the acute thorax cases, we have to go over the quiz cases from the prior video. There were 3 quiz cases. We'll start off with the first. So here we have a non-contrast enhanced slice through the thorax. It's specifically the left atrium, and here we can see that there is a very subtle hypodensity within the left atrium, and this was an example of atrial myxoma. We'll move on to our second case, T1 sagittal MR brain, and we have here an empty pituitary sella and an ectopic posterior pituitary bright spot. This is a case of ectopic posterior pituitary gland. Our third quiz case was a radiograph of the knee, and you have a widened intercondylar notch and a few differentials here, but the ones that come to mind for me at least are juvenile idiopathic arthritis and hemarthrosis. So we'll move on to our acute thorax cases, and I'll just say this now, not to offend anyone later, but there are going to be 2, maybe 3 non-acute cases in here, so stay on your toes. This is our first case. I'm just going to be going over the images in this video, and in the next video I will be giving the answers. So chest radiograph history is chest pain. We'll move on to our second case. Lateral chest radiograph history is also chest pain. This is a CT thorax, and history here is going to be cough, productive cough. We have a few more slices. You have to keep in mind that sometimes the history helps, and sometimes it is not the most helpful. Okay, and we'll move on to the next case. Here we have a scroll through case. And I'll go to the sagittal. Just a single view on the sagittal. History here is also chest pain. Not the most helpful history. Okay, next case. Chest pain. We'll move on to the next case. You guessed it, the history here is also chest pain. There's definitely a big acute finding here, and then I'll just let those small pleural effusions go. Next case. So these images were obtained on one day, and the patient came back on a different day and had these images. We'll move on to our next case. This case, the history also chest pain. And I'll come back up through that one more time. And we'll move on to our next case. This is just a single slice. Chest pain shortness of breath. Next exam, chest pain. I'm pretty sure they're all going to be chest pain, but I'll let you know on each exam. Moving on. Just focusing on the aorta here. History is also chest pain. History here is a cough for a few weeks. And we'll move on to the next case. We'll come back down and then we'll go to the coronal view on this one. Start at the top here. Okay, a few more cases. Here's another one, chest pain. I'll say hemoptysis for this one. Oops. Apologies. Moving on to the next one. Oh, that's the last case. So these are some acute thorax cases, and again, not all of these are acute. I'd say maybe 2 or 3 of them are non-acute. If you know the answers, feel free to leave them in the comments below. I'm going to be going over these exams in my next video, so if you're interested, stay tuned for that. That's going to be the end of this video, and thanks for watching. Bye.